Assalamualaikum warahmatullahi wabarakatuh. My name is Iskandar bin ROSDI from SR24355. My code is S07. My research title is Effect of Training Frequency on Post-Concussion Symptoms among Boxing Athletes for subject SRT606. Before I proceed to my presentation, here are the table of contents for my presentation, which are background of the study, statement of problem, research objective, significance of the study, literature review, methodology, and lastly references. In background study, I will explain about boxing, training frequency, and post-concussion symptoms. According to Chen and Stoffregen in 2014, boxing is an ancient sport that is practiced worldwide. Anecdotally, boxing is associated with the risk of head injury. Boxing sport utilizes most upper extremities, which are fist and elbow, rather than lower extremities, which is knee. In boxing, injury to head and face are commonly occur. It is because the boxer need to collect point by hitting to opponent's face and body. Next, training frequency refer to the number of times a specific muscle group is trained over a given period of time, stated by Schoenfeld in 2016. As example, a boxer train 3 to 5 days per week in their training session. Based on research by Ryan 2003, post-concussion symptoms, or called PCS, are a cluster of symptoms that frequently occur following MTBI. The symptoms that usually happen to the boxers are headache, dizziness, and nausea. Independent variable for my research is training frequency, while dependent variable is post-concussion symptoms. Next, we move to statement of problems. According to McLester in 2000, Schoenfeld in 2015, and Brigato in 2018, as early studies have shown that training either once or 3 times a week in trained subjects elicited similar improvements in muscular strength and hypertrophy. However, the American College of Sport Medicine in 2009 recommends that trained participants use a frequency of 4 to 5 days per week for the purpose of increasing muscle size and strength. Other than that, there is no conclusive evidence in the scientific literature about the risk factors associated with the development of injuries in either professional or amateur boxers, stated by Zazarin and Cameron in 2006. My research objective is to compare the effect between training frequency on post-concussion symptoms among boxing athletes. For significance of this study is this study's findings will provide critical information about the effect of training frequency on post-concussion symptoms in boxing athletes, and the frequency of training for boxing athletes is also crucial in determining the degree of concussion injury. For the first slide in literature review, I will explain about boxing. Journal by Maitland 1928, boxing was first associated with traumatic injury of the central nervous system, known as punch drunk in 1928. Punch drunk most often affects fighters of the slugging type, who are usually poor boxers and who take considerable head punishment, seeking only to land a knockout blow. It is also common in second-rate fighters used for training purposes, who may be knocked down several times a day. According from research by Zazarin and Cameron in 2006, a win is achieved by scoring more points than an opponent by delivering more blows to the designated scoring region of the body, such as trunk and head, or by an opponent being unable to complete a bout. Other than that, Chen and Stoffregen in 2014 studied that boxing is an ancient sport that is practiced worldwide and associated with the risk of head injury. Mostly, boxers experiences concussion after the training session or competition. In literature review for training frequency, Schoenfeld in 2016 stated frequency refers to the number of resistor training sessions performed in a given period of time, usually a week. Other than that, frequency can also refer to the number of times a specific muscle group is trained over a given period of time. Moreover, training frequency has recently received increased attention, and some authors consider it one of the most effective strategies to progress a resistance training program, stated by Dunkel in 2017. In the research from Dunkel also state that there may be a benefit for trained persons to perform greater frequencies of training. Concussion is defined as a complex pathophysiological process affecting the brain, induced by traumatic biomechanical forces, stated by Aubrey Chanto and Vorak in 2002. Moreover, research from Riot in 2003 state that the individuals sustaining head injuries often complain of a number of physical, cognitive and emotional or behavioral symptoms referred to as post-concussion symptoms, PCS. Furthermore, this cluster of symptoms has also been called dead symptoms because they are often reported a few days and weeks following the injury. Research design for this study is quantitative non-experimental design. It is because the respondent will be given a set of questionnaire to answer, then return back the questionnaire for the researcher to sum up the scale. In sample size, population for 3 boxing club in Selangor is 100 people. The sample size for this representative population is 80, according table Christie and Morgan 1970. Then a 20% sample needs to be added to avoid a non-return rate or dropout. The total sample will be 96 people. Then we move to sample technique. Sample technique for this study is non-probability sampling, which is purposive sampling. It is because the sample are not selected randomly. The sample already selected based on their training frequency, and the sample will be in group. The inclusion for this study are participants that suffer concussion will be in the study, and participants who trains 1 to 5 days per week also will include in the study. Other than that, the exclusion for the study are participants did not have concussion in last 1 year will be excluded, and participants who trains every day will be excluded. Instrumentation used in this study is the Rivermead Post-Concussion Symptoms Questionnaire, or the short form is RPQ. The author of this questionnaire are King and S. Crawford, F.J. Wendon, N. E. Moss, and D.T. Watt in 1995. There are 3 factors of domain in this questionnaire, consist of physical, cognitive, and behavioral. The population or respondent to answer this questionnaire is athlete or boxer, trains in 1 to 3 times per week, and athlete who trains 4 to 5 times per week. Nigel S. King in 1999 already studied the reliability for this questionnaire of head injury is excellent test-retest reliability and excellent inter-rater reliability. For mild traumatic brain injury, adequate test-retest reliability and adequate inter-rater reliability has been shown by Sustained in 2020. Furthermore, validity for this questionnaire is excellent with Hospital Anxiety Depression Scale stated by D. Guis in 2016. Other than that, Cronbach alpha coefficient of internal consistency calculated on the 16 items RPQ was 0.97 stated by Cernovsky. Here is the example of the Rivermead Post-Concussion Symptoms Questionnaire. Next, we go to next slide, which is data collection procedure. Firstly, participant or respondent will be gathered in a place to answering the questionnaire. Secondly, participant who trains 1 to 3 days per week and trains 4 to 5 days per week will be divided into 2 groups. Then, researcher will brief the instruction of the questionnaire. Next, participant will start to answer the questionnaire within 5 to 10 minutes. After the participant finish answering the questionnaire, researcher will collect the questionnaire and sum the score of the scale. Finally, participants will be informed of their score and determining the degree symptoms of concussion. For data analysis in this study, descriptive statistics will be used because it sums up a given data set, which can be either a representation of the whole or a sample of a population. SPSS also will be used to calculate the data from the respondent. Independent t-test will be used to compare the effect of training frequency between 2 categorical variables. Here is my references in this presentation. That's all from me. Thank you.